Thank you very much, everyone. I was planning to use the PowerPoint, but the computer is not responding, so I will start telling that I work for the cancer prevention team in Brighton and Hove, and I'm currently covered breast cancer. So today I will visit these three main points with you: screening, national screening, and screening in Brighton and Hove. A bit breast awareness point and the main risks. Okay, even though the clientele is not the target, because breast cancer is screening in Brighton and Hove nationally from women between 50s and 70s years old. I do not mind to deliver this talk because I think that everyone in this room knows someone between this age, 50 to 70. Can be a mother, a grandmother, a sister. So I think it is really good to share the message. So I would like to start mentioning what is breast awareness. Well, breast awareness means know what is normal for you, which changes we need to look and feel, and what to do if we perceive that something is not normal and something is not okay. So, what is breast screening program? It's a national initiative that covers always 50 to 70 years old women. Now they are implementing some changes, bringing down the age, so we will be between 47 and 73. They are enlarge this coverage. Will take some time to cover nationally. And what happened for this target? This target every 3 years receive an invitation to go and have a screening. Okay, it's free, and when they receive the letter, they just need to go and attend the screening. After 70 years old, women do not receive invitations anymore, although they are entitled to have the screening. So part of our job is to incentivize over 70s to keep going and having the screening. Here in Brighton,
can we ask questions, or do you want us to stay until
I would ask you to wait until I deliver the presentation, and then I don't mind to answer questions, okay? It takes place here in Brighton in the Park Center for Breast Care. So you have, all of you will receive this card that you can hand on for someone that you know, start talking about, because this is very important. It's important to mention that the procedure is carried on by a female, because sometimes women say, oh, I don't know, you know, the idea to change myself in front of a man is not for me. So it's important to stress that this procedure is rendered by a female. If something gets in the way, for example, if the operator gets sick and is not there and they put a man, the women, when they are there to receive the screening, they can say, I don't want to do today because this, and I prefer reschedule the appointment. So there is a flexibility to do this as well. Where we are now in Brighton and Hove, annually 25,000 women are invited, and 7,000 attend. Around 7,000 women attend the sessions. So we have, comparing to the national average that is around 79%, just 64% are attending the screening. So we are below the average. So that's why we are working hard to try to increase the level of engagement. Because if the women attend the sessions, we can save 4,500 lives every year. It's good to mention that breast screening is a preventative measure. So they will check and see if you have or if the person has some abnormality. In case the women note something, it's better go and talk to the GP, because this is a preventative measure, not for something that is happening again. The main risks, according to the Breast Cancer Care, that is one of the biggest charities that deal with cancer, the main risk is aging. So women have more probability to have cancer than men. For around 4,500 cases each year, we have around 300 cases for men. Men are not excluded to have breast cancer. So when we mention be aware of the changes, this can happen with men as well, even if in a small percentage of the case. Aging, as we get old, we have more possibilities to have breast cancer. So that's why the target is between 50 and 70s, because that is the point when we get more risk to get breast cancer. And family history. So if you have a mother or a sister that had cancer, so pay more attention. This not means that you will have breast cancer, but you are more in risk. So these are the three main points: aging, gender, and family histories. Some hospitals here in Brighton run cancer family clinics, that if you have something in family, you can ask your GP to be referred to, or if in case a city do not have this facility, the GP can make a referral for regional cancer genetic clinic. So it's an extra support that women can count with. Well, talking about risks, not attending the screening is a high risk. Another point is why is a high risk? Because the early detection helps to save life. So if someone is detected, what happens? The outcome of the treatment will be positive. So it's possible to avoid a mastectomy, that is the total removal of the breast. So why women do not attend the sessions? I think once we know, we are able to discuss and try to find a way to support even your neighbor, your sister, your mother. So for example, they believe they are not in risk. Oh, I don't have cancer case in my family, I'm low risk. Well, once we get older, we increase the risks to have breast cancer. Poor previous experience sometimes is very painful, but we can explore this point, telling, well, it's painful, but it's around 5 minutes, and this can save life. So it's a good point to discuss around. And fear of procedure. In this case, when the person received the letter and called to confirm, okay, I will attend, if there is any anxiety around this, they can ask, oh, can I go previously to see what the procedure is, and then to come down and to feel more secure to set up an appointment or to go for this appointment. So this is possible. So there are some other barriers around this. For example, communities very difficult to reach as BME communities, travelers communities, LGBT, lesbian, gays, bisexuals, and transgenders, homeless, elderly people, learning disabilities, people with learning disabilities, and learning difficulties in mobility, for example, and people living in disadvantaged areas. So we in the cancer team are specific targeting these groups to increase the participation in this screening. So what we are doing for this, delivering talk in community groups, using interpreting services for BME communities. For example, we have a big community of Chinese people here in Brighton, so assess an interpreter to be with us and to deliver on time the same presentation that we are doing. Use partnerships, multi-agency partnerships. So what did you do with that group? What function? What we can share? How we can work together? This kind of things we are doing now. And liaise with shelters for elderly people and adult social service to see what is possible to do better our job, to bring homeless to have this screening, for example. At least but not less, I would like to explore another point regarding to risks, that is lifestyle. So points like food, the way we are eating, alcohol, the intake of alcohol we have, smoking, if we smoke or not, if we practice any physical activity or not. This can make a difference in the future to be you're more susceptible or not to have breast cancer. So following the guidelines from the government, that would be have a balanced meal 5 a day, low intake of alcohol, respecting the unities that we mentioned yesterday, and no smoking and increasing physical activities would help us to battle or to reduce the risk of having breast cancer. I would like to make an exercise with you. So I will write these three, and I will ask you all, because time-wise, the three main risks that we have regarding to breast cancer, if you remember. I just mentioned 3.
Alcohol.
Age, well done. So we have age. So as we get old, it's easier that we can. It's easier now, but is a risk that we can get breast cancer. The other one. Gender. Who is more likely to have breast cancer? Men or women? Well done. And the last one, someone mentioned?
Family history.
Family history, exactly. So these using the reference of breast cancer care, are the 3 main risks around having having breast cancer. And in this other 3 that I have here, I will ask you other things that can contribute for us to being risk to get breast cancer. I just mentioned smoking. Well done. Smoking. So which would be the guidelines around smoking? Not smoking at all. Well done. Well done.
Alcohol.
Alcohol. Intake of alcohol. So if you need to drink, try to respect the guidelines around alcohol. What else? Diet. Have a balanced diet. What would contribute to have a balanced diet? 5 a day. Well done. Exercise. Okay. You can have half an hour a day and you can have 2 slots of 15 minutes, for example. You can build up around this. You don't need to start run marathons. Nobody that start run marathons obviously. And anything else that we could put here? I think it's okay. I would like to show this is a way to know what to look for and feel. For example, if you notice any lumps and bumps in the breast, puckering, swallow, if the nipples start to discharge something white, green, or pink, this is not normal. So be aware of this. If you notice something, go and talk to your GP, because it's better go there and he guarantee, well, this is nothing, can be an infection, instead of, oh, this is nothing, and the thing is getting worse and worse and worse. So you jump for early detection that can save your breath to be able maybe to remove and have a mastectomy. So I will leave this here, and I will invite you after to look around, and also invite you to start talking about, because when we start talking about things, we don't have taboos anymore. So we jump, and sometimes, and we had this experience, one of our co-workers, she was delivering a talk in a shelter, and one of the ladies said, oh, do you mind if I have a word with you? And then she said, well, I'm not clinically, we're not clinically trained. And she said, well, I'm not clinically trained, but we can have a word. And she mentioned something, and my colleague said, well, it is better really talk to your GP. And the lady has 3 or 4 symptoms that could be breast cancer. So sometimes when we deliver this kind of talk, we are not will not be helpful immediately for you or for you, but you can have a friend, you can have a girlfriend, you can have a wife, and just start to have this conversation. I think can be very helpful. I have an evaluation form for you that I would appreciate if you could answer the questions for me. And I will also handle some leaflets that I hope can be useful. And if it's not for you, if you can kindly spread around for me. And if you have any doubt, I will be happy to answer any questions now.
Do you know why women over 70 don't tend to screen?
Well, research were made, and they detect that is the period when the risk gets high.
But why don't they go? Why do they stop going screening?
Oh, they stop maybe because of the commodity to receive the remind to go. Mm-hmm. Because what happens is, even though sometimes they receive the invitation, they put in a drawer, close and forget. So when they don't have that stimulation, sometimes they can just, well, you know. Or another thing, another feedback that we have sometimes is, you know, I'm too old for that. I don't want to discover anything now at this point of my life. And sometimes, recently I have a client, she was 83 years old, and I mentioned, where was the last time that you went for a screening? And she said, oh, I was 70. And I said, how old are you now? Oh, 83. And I said, and what's happening? Oh, you know, I didn't receive the invitation, I'm feeling okay, but I think it's better if I go to check, because it doesn't mean that I will discover something. Mm-hmm. So it was very positive.
Why don't they get an invitation after 70? Why is it stopped? So, why don't they?
That is a good question. I think it's some decision that we have from the top. Really, we need to, for example, why cervical screening take between 25 and 64, because there is a huge incidence in that target, so they look for that target. Probably because after 7, the risk gets high, but the amount of case slow down. So I think this is a great question. I will check with my manager. I don't have. Oh, thank you.
Thank you.